Hello and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Zachary Schwartz. In this series, we'll hear from a variety of patients and patient advocates as they discuss hepatitis B care in the United States. In this episode, we talk to 3 Asian American patients and we focus on solutions to HBV care from the patient's perspectives. We'll hear from Dr. Thuan Vu, who's a rheumatologist living with HBV, and Jennifer Wild, who's a registered nurse living with HBV. But first, let's start the discussion with patient Melinda Tran.
So I didn't know that I had hepatitis B. I was first told I had hepatitis B when I was pregnant with our first child, and that's when I got tested. Although I was told I have hepatitis B, no one told me to seek treatment or care for having hepatitis B. So that went untreated for, I would say, probably 20 years. And I didn't realize that having hepatitis B, you need to get treatment or at least, see a doctor about it. And so about 10 years ago, I was starting to feel kind of tired, lethargic. And my dad, who went to a GI doctor and was diagnosed with having hepatitis B, and he said he got a medication. And I thought, wow, this is really kind of like my first step into thinking I really need to go see a doctor that specializes in hepatitis B or GI. And so when I went to see my doctor, and sure enough, I was tested positive for hepatitis B. And, he was at follow up with me. So I have to follow up every 6 months with my doctor. He got me on the treatment. And from there, I also had to introduce my husband to get himself tested as well. So I think just being aware that you have hepatitis B and that you do need to seek a doctor to see if you need to have treatment at the stage where your hepatitis B may be in. So the barrier, I think, in terms of treatment also would be that it does, if you don't have insurance, it does cost a lot of money to have the medication, the therapy. Like for my medication, if there was an insurance, it's actually $1,000 for a 30-day supply. And so I think that's a huge barrier for someone that is not financially able to do that. As far as solutions, I think although hepatitis B isn't have the same awareness like diabetes or high cholesterol, but I think if you make it a campaign to be aware that hepatitis B is also a disease that are treatable and it's a lifetime of care for it. So I think it should be, become more affordable in terms of the treatments that are available out there, for something, as common as diabetes or high cholesterol.
That's a really good comparison. Diabetes and high cholesterol don't go away, but we treat them, right? We can control them. And that's how it is here too. Thanks for sharing, Melinda. I think you bring up some good points about treatment that there's maybe for your experience. It sounds like when you were first diagnosed, maybe the provider who diagnosed you didn't know that you needed treatment, or perhaps they recommended it once and never brought it up again. And perhaps because there is no cure, as you mentioned, perhaps people think, well, what's there to do if there is no cure for it? But yeah, education and campaigning, I think, are 2 things we could do for sure. Dr. Vu, do you have additional thoughts on that discussion?
I think that from what I've reading so far, when you are a carrier which is silent and your liver function tests are still normal, maybe the physician can wait and monitor closely. But when you have that DNA virus copies getting to a certain extent, I think it's worth to do treatment, and the goal is to suppress the viral DNA to an undetectable level. And there's been several studies over the last several years showing that if your DNA virus, the copies are undetectable, your chance of developing liver cancer is much lower. Not quite back to the normal population, but I can be to a very acceptable low level, and that is really worth the treatment.
Yes, you bring up a good point that the guidelines for treatment after diagnosis is confirmed can be sort of hard to follow. I think, for me as a master's degree prepared RN, I know that I still have to look at the guidelines from time to time. I don't have them memorized. They can be complicated, let alone for a patient who's trying to look up their own information online on their own disease status and try to inform themselves. I wonder if it might be helpful in the future to have some kind of scoring tool to help providers to know when to diagnose, based on these labs, based on these other data you enter in a website, the same way we calculate MELD scores or Child-Pugh scores in hepatology, right? That might be useful. Right. Okay, so let's go back to the solutions components, because of course we want all of our providers who are attending this education topic to maybe walk away with some useful pearls and things they might be able to change in their practice. So for the section that I discussed about screening and diagnosis, I do think still that some of the things I mentioned earlier would be potentially helpful, but maybe even just having the providers really use those interview skills. I know it can be hard when clinic time is very crunched, but asking a patient and making it clear why they're asking, that there's not any insidious reason or racism behind it, but saying, as an Asian American person, may I ask you where you were born or where your parents were born as it pertains to any disease risk? Asking those questions and then even addressing some of the psychosocial things that I think clinicians, we get so focused on the data. What's the lab say? What does the imaging say? And sometimes we forget to have those personal conversations about how people feel about some of these medical topics and diseases and why we're bringing it up. So even just putting oneself in that mindset that this could be not just a clinical subject, but an emotional subject for the patient, and I should bring it up, is, I think, a solution that doesn't take really a lot of extra resources except for the inner resolve. Melinda, what kind of solutions would you like to emphasize from your subject about treatment and retention to care?
So on the treatment, I think as a provider, to let the patient know there are treatments that are available, from medication to immunotherapy, because without the treatment, for one, it could lead to cirrhosis and even cancer, and worst case, it could lead to death. And so I think having available treatments and providing those treatments to your patients, like myself, is a tremendous help, because I think some people, or some patients are not aware that, there are treatments that could put hepatitis B into remission. So although you continue to have hepatitis B, but at least it's treatable, although not curable. So those things would help. And then the other thing too is, unlike diabetes or high cholesterol or high blood pressure, hepatitis B, if you're not aware of it, you could, as a carrier, pass it on to someone else, like your partner. And so I think just being aware of how hepatitis B can transmit, and the treatments that are available to help out with with the disease itself, and that it doesn't need to be a stigma for having the disease.
It sounds like you're saying improved counseling on treatment options and preventative measures. And for you, Dr. Vu, what are the solutions you would like to emphasize on the subject of linkage to care?
I think for primary care physicians who are Asians, have a lot of Asian patients, it would be good. It would be great if we can have in their office, for sure, have the physicians be more aware of that in their own community. Let's say if majority of the patients are Asians, and to be more aware of hepatitis B as a risk factor for cirrhosis and cancer. And be more aware of that, take the test more often, and have a brochure in the office, and ready to give it to the patient once the lab is positive. And not only the patient, but also family members, because this is infection. So a lot of people may not have any symptoms, or even normal liver function tests can still have that as a carrier. So it's important to know. So again, the key word, like Melinda said, is awareness. But if the primary care physician have more awareness and have more information, even in brochure, and give it to the patient, if they don't have time to just give it to the patient, and especially translating to their own language, I'm sure we can do that, and then give it to the patient and family members. Or if a lot of times the patients can be old and confused, but they can give it to the family members, like son or daughters who are with them in the office. Go home, read about that, and let me know. And we need to not stop there. We need to review that and monitor and go from there. And if necessary, refer to a specialist about hepatitis B, because it's a big deal. It's important.
Yes, that referral is a very important component for sure. I do hear an overlapping theme in all of our solutions, though, and it has to do with education for the primary care provider in order to improve the counseling and conversations that they have with their patients. So I thank you all for your input on these potential solutions.
Well, thank you to our panelists for your excellent insights. To hear other episodes in this series, see the show notes or go to the Clinical Care Options website. Thanks for listening.